Hi, everybody. This first slide reviews sample submissions and how samples are sent from your agency to NMS labs. We really have three main steps. Step one is sample collection. And with that, you're going to want to make sure that you are collecting the appropriate matrices for your case into the correct sample collection containers. Forms need to be completed so when the samples arrive at the laboratory can know information about the case and what test codes you would like performed on what matrix types. And then finally, step three is the shipment of samples from your facility to NMS labs. So to start, the chain of custody information is very critical for forensic science cases. We need to know where the sample arrived from and when it was received at NMS labs. The importance of the chain of custody is to help demonstrate or to show who had the specimen, when they had the specimen, and why they had the specimen. NMS labs, regardless of the chain of custody information prior to its receipt, will initiate chain of custody per NMS lab's protocols when the samples arrive at the laboratory. Overall, the samples should be packed to prevent the breakage of the sample collection container or leakage. Failure to appropriately pack the samples may lead to the samples themselves being compromised, and the worst case scenario is that they are not able to be tested. We have different types of sample collection kits that you can use for your cases. The first is a postmortem toxicology kit, and it comes with the collection containers you can use for the case. It's one of these kits per case. The contents of the case or the kit includes two gray top tubes. The gray top tubes contain sodium fluoride preservative and potassium oxalate. The sodium fluoride preservative helps to stabilize drug and drug metabolites that are present in the blood and help prevent microbial growth, which can lead to in vitro formation of alcohol. It also comes with one 30 ml plastic container, which can be used for urine or for tissue. Comes with a specimen bag with an absorbent sheet and a vial sleeve that can hold 6 vials and the security seals. Some suggested samples for the postmortem kit is to fill one gray top tube with cardiac and one gray top tube with peripheral blood. If only one of those matrix types can be collected, the laboratory would prefer 2 gray top tubes of peripheral blood, and the femoral or blood taken from the femoral vessels are preferred. And then we have 30 milliliters worth of urine in the plastic container, but that container, like I said, can be used for tissue as well. We have some kits that are used for alternate specimen types, and a prime example is hair. Hair is not probably needed or collected in every single case, but the hair matrix can help demonstrate repeated use of a drug. prior to death, or sometimes hair depending upon the state of the body may be the only sample that's available for testing. So hair samples, where possible, should be collected using the hair kit. It's important for the root end of the hair to be aligned, and the hair specimen collection kit has instructions and the materials that are needed that you can use to help make that happen. Sometimes hair is not able to be aligned. A picture on the right shows a hair sample that was collected and sent to the laboratory for testing. The laboratory can handle specimens where the root ends are not aligned, but some interpretive information concerning timeline of drug use may be impacted. But a hair sample like this can still be tested.